Welcome back. Now, some of us may not be crazy about the prospect, but really, we should be visiting the dentist a couple of times a year.
As our health specialist, Beatrice Bleedy, tells us, it turns out it's particularly important if you suffer from rheumatoid arthritis.
It's true. Now, they say that the eyes are the windows to the soul, but your mouth may also shed light on what's happening in the rest of your body. It's something all of us should be doing at least 2 times a day, and not only for a healthy mouth. What happens here can affect the rest of our bodies.
There are a number of studies which have shown that diabetics have very poor glycemic control when they have periodontal disease. We know that women are more susceptible to premature low birth weight births when they have periodontal disease, active periodontal disease in their mouth.
Studies have also found a connection between dental infections or conditions and cardiovascular disease and heart attacks. And now a new study says there's another connection to rheumatoid arthritis.
This study clearly shows that the suffering, the pain, the symptoms associated with rheumatoid arthritis are dramatically improved in patients who improve their periodontal and their oral health.
Rheumatoid arthritis is an inflammatory disease which attacks bone and soft tissues. Periodontal disease is an infectious inflammatory disease which affects the bone, the ligament, and gum tissue that supports the tooth.
You can clearly see the red inflamed gingival tissue.
The study says inflammation in the mouth sends inflammatory mediators or chemicals into the bloodstream, where they can infect new areas or aggravate sites which are already inflamed, as in rheumatoid arthritis.
A clear symptom that patients may notice if they have periodontal disease when they're brushing or flossing is bleeding that may occur in the gingiva, particularly between the teeth.
Though the most many of us deal with is a cavity here and there, it seems periodontal disease is something more than a few of us need to worry about.
The prevalence of periodontal diseases in 35-year-olds and older is in the neighborhood of 30 to 50%.
One of the things to remember is you may have periodontal disease and not even know it. It can be a painless disease, and the first sign for some may be loose teeth. And here's something to think about. Dental decay and periodontal disease are the most common diseases in humankind.